Breast reconstruction with tissue expanders is probably the most common way breasts are reconstructed in the U.S. and it's probably also the most common way that we do it in our office. So what happens is at the time of mastectomy, usually at the time of mastectomy, though it can be done later on as well, the breast tissue is removed, but the breast skin usually is preserved, sometimes the nipple as well. At that moment, as soon as the breast surgeon has removed the breast tissue, an expander, which looks like an implant but has no fluid in it, it's empty, is placed under the skin and sometimes under the muscle. And we also use a piece of ADM, which is short for acellular dermal matrix. It's essentially human skin that's been treated in such a way there's no cells, it's just a sheet of collagen. We sew it around the tissue expander to hold it in place. It's like an internal bra. The tissue expander gets filled with saline or salt water, and so it can be expanded to a certain size. Now we decide how big it goes at the time of surgery, but that's not the end point. We close everything up over a drain, we let everything heal, and after about 2 to 3 weeks we can continue to expand it, fill it even more, and then we can just decide essentially how big that breast should be. Now that can be done on one side or both sides. When we use a tissue expander, it's a stepped procedure, meaning it's a first procedure out of a series of procedures. The first one, the tissue expander goes in. You heal from that. We expand the tissue expander and decide what size. And then we go back to the operating room, remove the tissue expander, and put in a permanent implant, one that can stay for years and years. And the permanent ones are much softer, they look better, they feel better.